Professor, it's a great honor to welcome you here in our academy in Elbląg. We are really fortunate to have you here today, especially that you gave a lecture. But before I ask you a few questions, I would like to ask you specifically for your background and professional experience.
Okay, thank you for the question. The honor was mine because this is a prestigious university and academy, and I was surprised from the organization of your job and for the visit that I made about your center. My background is that I am a general surgeon. Nowadays I am from 20 years full professor of general surgery at the University of Bari. Bari is a big city in the south of Italy and is one of the most important university in Italy. And I am the chief of the head of the Department of Emergency and Urgency at Polyclinic of Bari and the chief of unit of general surgery. At least I am the director of a residency program in my university of general surgery. And my background, surgical background, I lived for 2 years in Pittsburgh, in Pennsylvania, at Presbyterian Hospital, and then in France, at Nimes, in which I developed, above all, general surgery regarding abdominal surgery. And nowadays, my application is for all general abdominal surgery and neck surgery.
Professor Testini, thank you for your insightful lecture on thyroid surgery you have delivered to our medical students.
Yep.
And basing on this experience, I would like to ask you, what advice would you give to our students to become even better doctors in the future? What should they start doing now to become better and better?
Okay, I think that the most important application of the student is to study and to, in particularly in surgery, to know very well anatomy, because it is impossible to perform an operation of abdominal or neck and so on surgery without a perfect knowledge of anatomical structures. And this is a requirement fundamental in our job. And the second is that during their studies, I think it's very important the practical application of the study. Okay, and for example, this center of simulation is a wonderful realization for this concept, and probably when a student finish their studies with a important practice regarding medicine and surgery, is better than students that finish their graduation only with exclusively with theories and not with practice.
You mentioned our medical center.
Yeah.
You have just been there and seen the
yes
and the facilities altogether.
Yes, wonderful.
Academy. What's your experience, except wonderful? How do you find it?
Yes, I think that another very important step should be the application of artificial intelligence to that systems that are very important for the student, but in the future, I think no more long, we can realize the situation of various disease by mean the apply of artificial intelligence to simulate, for example, disease, surgical indications, and so on, both in medicine and in surgery.
In a moment, you will be leading a workshop, and I would like you to tell us, so briefly share, what the participants can expect from that session.
I don't know what they can expect, but pancreatic surgery is an extremely difficult surgery, and at the same time is fascinating and amazing, but is a challenging for the surgeon because it's a pyramidal number of surgeons that normally perform general surgery. Only a very few number are able to perform a pancreatic operation. And the topic that I'll present in the afternoon is a very particular situation. The performance of pancreatic duodenectomy in emergency. It is an extremely rare situation because usually pancreatic surgery is only an elective surgery. But I think, this is my opinion, is that knowledge of pancreatic surgery should be part of the armamentarium of the general surgeons that work usually in hospital in which emergency and urgency are done for the reason that sometimes it's impossible to take the patient in emergency and to transfer him in a dedicated center. I think that in the armamentarium of general surgery nowadays is necessary a correct pancreatic training.
Thank you very much.
Thank you.